Hi, my name is Anne. I am an NCLEX success strategist with VPNG NCLEX Academy. Today we're going to discuss mastering NGN clinical judgment. Why we have an NCLEX Academy where we train international nurses to pass NCLEX after 90 days. And one of the ways we measure success and understanding for our nurses is with our tasks. So we give pre-class tasks, general tasks at the end of intervals just to ensure that everybody's following along. And we just noticed that there's a difference between having knowledge and actually using your knowledge to answer question banks correctly. And so today we decided to dissect the science behind answering NGN questions correctly, and we have 10 points, and this will help you even in situations where you're unsure. You can effectively guess the correct answers correctly. For emphasis, NGN is not simply a test of knowledge. It evaluates how you think, how you prioritize, how you make decisions in complex clinical situations. Traditional exams might ask you to recall facts. NGN is testing you on 4 things: how you interpret clinical cues; 2, how you identify risk patterns; 3, how you select appropriate interventions; and finally, how you can prioritize life-threatening conditions. And this reflects real clinical practice. It aligns with the decision-making required to safely pass NCLEX and other global nursing licensure exams. So what's more important than a lot of studying is studying the pattern of reasoning. And on that note, I'm going to go ahead with the 10 points that should help you simplify NGN scenarios. First, you need to learn to recognize the disease pattern before choosing an intervention. One of the most common NCLEX NGN traps is choosing interventions before identifying the condition. In the scenario, a client might report that they have sudden urge to urinate, they are unable to delay urination, frequent voiding during the day, no liquid when they cough or sneeze, negative urine culture. This pattern indicates urge incontinence, also called overactive bladder. Once the pattern is recognized, the correct interventions become obvious. So what do you need to do to intervene? Bladder training, also called timed voiding; pelvic floor exercises; avoiding bladder irritants; antispasmodic medications. Interventions that do not match the pattern should be eliminated. Say in your question you see options like antibiotics where there is no infection, or pessary devices used for stress incontinence. I hope this makes sense. So what's your strategy? When you face an NGN intervention question, you need to first identify the disorder. What is the underlying mechanism? And then you choose interventions that target that mechanism. If you skip the step of identifying the disorder, despite all of your knowledge, you're going to be too forward and you're going to select incorrect options. Point 2, NGN frequently tests the incorrect technique. So a common exam pattern with NGN is evaluating whether patient teaching was done correctly. For instance, you find questions like, which of the following statements by the patient signals the need for further teaching? Remember, if you're in our academy, when we talked about prioritization and delegations, we discussed some duties that are peculiarly within the ambit of the nurse's performance. For instance, the first teaching before discharging a client. Assistants can reinforce, but the first teaching is the role of a nurse. And that is what these types of question test. For example, hearing aid management, we may include several statements from a patient describing their daily routine. And some actions may appear correct, but then they contain subtle mistakes. And examples of incorrect techniques include 1, pulling the ear down and back instead of up and back during a session. 2, turning the volume up when a whistling sound occurs. Third one could be cleaning the hearing aid with water instead of alcohol wipes. Now, these questions are testing your attention to procedural detail, not just knowledge. Okay, so when a scenario is one that you have to evaluate your patient teaching, you need to look for actions that damage equipment, worsen symptoms, or violate safety principles. 3 common NGN teaching traps are incorrect direction of movements. Remember, we just talked about pulling the ear down and back instead of up and back during a session. Another one is incorrect equipment cleaning methods or adjusting settings in the wrong direction. If the action worsens the problem, it usually requires a follow-up. That takes us to our third point. You need to understand the difference between harm and prevented harm. This is an NGN concept that focuses on patient safety classification. So in healthcare quality systems, 2 important terms appear: sentinel events and near-miss events. Sentinel events are serious preventable errors that cause patient harm or death. Examples could be wrong side procedures, inpatient suicide, falls that cause fractures, medication errors causing severe reaction. These are sentinel events, okay? The next type of actions are near-miss events. So errors that are caught before reaching the patient. For example, detecting incompatible blood before transfusion or identifying medication calculation errors. Now, what's your strategy for the exam? When classifying what type of errors, okay, you need to ask yourself one question. Did the patient experience the harm? If the answer is yes, it's a sentinel event. If the error was intercepted, it's a near-miss event. So this simple distinction appears frequently on global nursing exams. So if you see it on your question bank, well, you know you already heard this from VPNG. Point 4, you need to recognize behavioral red flags in professional practice. NGN questions test ethical and professional awareness, especially regarding medication safety. For instance, drug diversion. Drug diversion occurs when controlled medications are taken by nurses or healthcare practitioners for unintended use. And the common warning signs include when a nurse is excessively wasting narcotics or frequent volunteering to administer medications for other nurses, or inventory discrepancies in dispensing machines, or when you ask colleagues for their medication system passwords. These behaviors suggest an attempt to access these drugs without being detected. So in your exams, when you're evaluating possible diversions, you need to look for actions that involve controlled medication access. You need to look at documentation manipulation. You need to look at avoidance of oversight. Friendly relationship with your co-workers are not indicators of diversion. You just need to look out for actions that imply that the nurse is preventing the drug from reaching the patient that it was intended to reach. Point 5, you need to identify medication side effects before treating complications, because many NGN questions test whether candidates can recognize medication-induced systems. For instance, iron supplementation causes hard stool, causes strain during bowel movements, can cause abdominal bloating. This pattern indicates iron-induced constipation. And what are your correct interventions? You can increase dietary fiber, you can increase fluid intake, you can use stool softeners, you can adjust toileting position. A key exam trap is suggesting that patients take iron with meals to prevent constipation, because even though this may reduce stomach irritation, it can decrease iron absorption, making it an inappropriate action. Okay, so what's your strategy? When symptoms appear after a medication is started, you need to ask yourself, is this a known medication side effect? If yes, treat the side effects, not the disease. Next, mechanical systems that have mechanical problems. NGN scenarios could include equipment-based care, such as traction systems. A skeletal traction system must maintain continuous pulling force to keep the bones aligned. And a major error occurs when the weights rest on the bed frame instead of hanging freely. Why? Because this would disrupt the traction system, and the patient may report severe pain, which indicates muscle spasms, bone misalignment, traction failure. So whenever medication equipment is used, you need to check, is the system functioning properly? Are there mechanical components positioned correctly? Because improper equipment positioning is usually the root cause of symptoms. Point 7 is always anticipate complications of immobility. Clients in traction or prolonged bed rest, they could develop predictable complications. Talk about deep vein thrombosis, constipation, atelectasis, pressure injuries, especially pressure injuries. or bone infection from traction pins. Now, because these risks are predictable, you as a nurse must be able to anticipate preventive interventions like incentive spirometry, anticoagulant therapy, stool softeners, frequent skin assessments. So whenever immobility is present, you need to run yourself through this checklist: DVT, lungs, skin, bowels. If a question asks what the nurse should anticipate, the answer is usually one of these complications. Now to the 8 points. Prioritization must always follow life-threatening risk. NGN questions will ask which patient statement requires immediate follow-up. In immobilized clients, the statement, I feel pain and tightness in my calf. That is a hint. That suggests deep vein thrombosis. And this condition is dangerous because the clot can travel to the lungs and cause pulmonary embolism, which can be fatal. So even if other problems are present, such as infection or emotional distress, the risk to circulation and oxygenation takes priority. So you should always prioritize conditions that threaten airway, breathing, circulation. Pain or swelling in one leg almost always signals circulatory risk. Let's move to our next point, which is the 9th point, I think. You need to prevent pressure injuries with proper positioning. Now, patients who remain immobile, they are very vulnerable to pressure injuries. A deep tissue pressure injury would appear as, purple maroon discoloration, intact skin, it will be located over bony prominences. A common mistake is placing pillows or towels directly under the wound. This increases the pressure rather than relieving it. So what's your correct management? Offloading the pressure completely. So in the exams, if the scenario presents you a case where you have to manage pressure injuries, the rule is simple. There must be nothing under the wound. Pressure must be removed entirely to restore circulation. The 10th point is understanding occupational safety protocols. How NGN scenarios include workplace safety situations. If you're enrolled in the academy, we've said it a million times that NCLEX presents you a perfect example. This is, by the way, a perfect hospital. You don't lack anything. There's enough staff, there's enough material, there's enough everything. All you have to prioritize is the safety of the clients. This is by the side. But then you have a duty to, as much as you protect the clients, protect yourself as a nurse. Now, if a nurse sustains a needle stick injury, what are your immediate actions? You need to wash the site with soap and water. You need to report the exposure. You need to screen the patient for bloodborne pathogens, and you need to initiate post-exposure prophylaxis if needed. Of safe actions would include recapping the needles or squeezing the wound. So for needle stick injuries, remember the sequence. You wash, you report, you test, and you treat. Wash, report, test, and treat. Third time, wash, report, test, and treat. This protocol protects healthcare workers from infections, obviously like HIV and hepatitis. So success in NGN depends less on memorization and more on pattern recognition and clinical reasoning. This is not to say you don't need knowledge. You need a lot of knowledge so you can make decisions in the exam. That's why our academy exists, for instance, because we understand the importance of knowledge. But in addition to having all that knowledge, you need good pattern recognition and clinical reasoning. Any high-performing candidates applies their 4 thinking steps, which is they identify the clinical pattern, they determine the underlying risk, they prioritize life-threatening conditions, and they choose interventions that address the root cause. Some interventions might be, reasonable, but not pressing at the time. For instance, advising the client or just being there for them when you have to fight to restore their airway, circulation, etc. So mastering these steps prepares you not only for NCLEX but for safe clinical practice in any healthcare system. So if you enjoyed this video, imagine if you learn every system in NCLEX with patterns that have been drawn out of question banks. And that is why you need to enroll in VPNG NCLEX Academy. From only $20 per month, we have a system that is engineered to help you pass NCLEX in 3 months. So sign up. You can visit our website, vpngglobal.com, Subscribe to this channel, like and share to other NCLEX candidates, and see you at our next video.